Good morning, everybody. Morning. Those of you who are still getting food, you may continue. I'm Ross Sandler. This is our City Law Breakfast, and I welcome everybody to the new wonderful building at New York Law School. Yeah. Oh, thank you. Our old building didn't get applause, but the new one deserves applause, and I'm happy to. And if any of you would like to go to law school, if not already, it's a great place to go. The classrooms are wonderful, and the students are very happy, and so are the professors. These breakfasts, we're delighted to continue to sponsor them. This is probably the 14th year. I never counted it all up. But we've had loyal sponsors along the way. Con Edison has been a loyal sponsor throughout, Verizon, Greenberg Traurig, the law firm of Greenberg Traurig, and the Murray Goodgold Foundation. And those are the people who fund this and allow us to continue to have these breakfasts without charge in this Civic Center area. Sometimes we have repeat performers, and Linda Gibbs is a repeat performer. Her role in government is now shown longevity, and she has been a very important person in a very important part of government. I looked at her bio, and the striking thing about what is on the website is the span of her responsibilities. And well, I know most everybody in this audience knows probably all of this, but I thought I'd just read it again. As deputy mayor, she is the person who pulls together the Department of Health and Mental Hygiene, the Department of Human Resources Administration, think of welfare, all those issues, the Administration for Children's Services, foster care, and all those issues that she worked on many years ago. The Department of Homeless Services, been in the news lately, another issue that persistent and seemingly endless issues there. Department of Aging, we're all getting older. I noticed it's an area that I'm most concerned about, and I'd like to speak to her later about. Health and Hospitals Corporation, the largest municipal hospital system in the country. Department of Correction, Rikers Island, Department of Probation, dealing with people who've been released from the system of correction. Department of Juvenile Justice, an area of immense importance, and one that does so much and has to do so much with the future of younger people. The Office of Health Insurance Access and HIV Health and Human Services Planning Council. The span is truly enormous. It's the areas of government that are probably the most difficult to deal with. I was fortunate. I dealt mostly with bridges. They didn't talk back, and they didn't protest. But to deal in this area, it takes a great soul and an enormous amount of energy. And so we're delighted to have Linda Gibbs, Deputy Mayor, here to speak to us again today.
That's very cute. I never thought about that, the talking back aspect of the challenge of my job. That's cute. So a real pleasure to be here. It's a pleasure to be in this spectacular building. As I was coming out of the elevator, I said to the young woman who was guiding us all down the hall, "Boy, it makes you want to go back to law school." And she says, "I don't think so." So lest you really believe, Ross, that this is enough to overcome those challenges of law school. But she has third-year-itis and is looking forward to graduation despite the spectacular building. My husband's here today, who's a graduate of New York Law School, as is his brother and his brother's wife. So we are in that sense very much a New York Law School family. So what I'm going to do is I'm actually going to take a little bit of my time to just give highlights of the accomplishments in these areas for the last 2 terms before I turn to focus on the next 4 years and what I think are going to be our challenges and what I think are going to be some of the most important areas that we'll be working on. And, and I have to say, it was really hard to trim this down. And despite the fact that it was really hard to trim this down, I have like 8 pages of accomplishments. I promised not to read it all, and so I have like just the words highlighted. But I actually asked my folks. I said, let's really think about, what are the highlights of the things that we've done, and it's hard to pick among them and to winnow it down. But to me, I think it's part of the hopeful, never-ending optimism. So far, I have never-ending optimism. Let's see how we fare in this fiscal time ahead. But part of the optimism is really about the remarkable changes that have happened in the city over the last 8 years in these areas. So let's think about it. Health and mental hygiene. Life expectancy in New York City, it's now if you're born today, this is how you do life expectancy. For the kids born today, it's all about how long they'll live. Kids born today are going to live 1 year longer than the kids born 8 years ago. So life expectancy now, 79 years. That's 6 months more than the nation. Who would have ever thought that people that live in New York City were healthier than the nation as a whole? Some of the contributing factors to that, the smoking rate has fallen by 27% in the city. And that will prevent 115,000 premature deaths in the future. The teenage smoking, anytime I see a kid lighting up with a cigarette, I'm thinking, why haven't we become smarter? Teenage smoking has been cut in half in the city. High school students has actually fallen by more than half, and our teenage smoking rate in the city is half of that of the nation. We've done a tremendous amount on helping people to think about their health and having electronic health records. We have over 1.5 million individuals who's through our community health providers and clinics are now having their records kept electronically. This makes people healthier. 2 reasons. One is that it actually acts as a prompt to doctors who are managing an individual's case. It's on an electronic record, you can see more easily, did they get their annual checkup, have they done their follow-through, and it improves the management so that you don't actually prescribe drugs that are counter to other prescriptions you might be getting. So this is one that the research, because electronic health records are so new, the research hasn't yet been developed that demonstrates these healthier outcomes, but we actually have a number of studies going on in health and mental hygiene, and I guess the true believers have got me believing that it's just a matter of time before we have the evidence to prove that. And of course, on calories and our challenge of overcoming the obesity epidemic in the city, our Healthy Bodegas initiative, we've banned our trans fats, putting calorie postings in chain restaurants. We are second to the Defense Department. New York City is the largest provider of meals on a daily basis in the country. What we've done is across every agency, we've required that the menus of those agencies adopt healthy food standards. So from the Department of Education, which has been an incredible leader on this, and Kathleen Grimm is here, also an alum, and the Department of Corrections and the meals that we serve on Rikers Island. I don't know if you guys remember, now they're cutting slices of bread to the prisoners. Well, it wasn't really a budget cut. That was part of just making sure that the nutritional content of the meals that we're serving on Rikers was healthy. And one of our favorite new initiatives, putting green carts on the street, increasing the number of vending licenses to individuals selling in poor neighborhoods that have an insufficient supply of affordable, nutritious food, to allow green carts to provide that in vending carts in our neighborhoods. So the public health agenda has been obviously gotten a great deal of recognition, not only for how ambitious it is, but for the impact that it's had. In homeless services, Ross was actually a tremendous support to the city when I was at the Department of Homeless Services, and really struggling to take ownership of that agency back. It was one that, originally for very good reasons, had been come under court scrutiny, had been subject to lawsuits, and the city had entered into consent decrees. We had judgments entered against us. But 25 years into that process, the agency had lost its grounding, and the litigation surrounding the agency had really driven the agenda. Ross's fabulous book, Democracy by Decree, really put the spotlight on this issue of what the impact is in circumstances where those can go on too long and really disempower the agency management. And so the very strong progress within the Department of Homeless Services has been that the management, the services that are provided by that agency are now so sound and so well managed that the parties and the judge all agreed that on the family side to leave the city's management to itself and remove it from the court's supervision. So that being said, the fact of family homelessness is a huge challenge that remains one that the city is grappling with. We have had year over year over year increases in the double digits in the number of families coming into shelter. That knocking on the front door is just really astronomical in terms of the demand that we're seeing. The really good part of this is that all of the reforms in terms of managing that front door are holding up. Families are continuing to receive service quickly, meaning that they will have their applications taken and they will get a shelter placement on that day. And so in terms of just, how do, our compassion and our concern about the needs of people who become homeless, their needs are being met. That being said, I think we have a huge challenge in front of us in thinking about what are the more fundamental solutions that are going to prevent that from happening. We have great home-based prevention program that has served almost 20,000 families at this point. That has helped to address some of those needs, but all that's done is really, I guess, reduced somewhat the demand. And I think a lot of these issues that we've seen in the past couple of days that have brought a spotlight on what we all know about overcrowding in housing in the city, I think renews our need to look at those issues and understand more fundamental solutions to housing stability. The flip side of homeless services, and really one of my most proud things that I think about, is the reduction of street homelessness. We instituted 5 years ago a count where we go out on it's a cold winter night, the last Monday in January, first Monday in February, and we field 2,000 volunteers on the street, and by a very rigorous methodology do an estimation of the number of people living on the street. We've seen a reduction from 4,500 in the first year that we did that down to 2,400 this year, 2,300 this year. And so a reduction of just about 50% of the number of people living on the street. There's been, that's just the flashpoint that gives the evidence to the progress. It's not just about doing a count. We've reformed our street outreach work. We've built alternative ways for individuals who choose to stay on the street, that they may come into a safe, warm place that is the size and shape of something they'll actually accept, compared to some of the, entering the front door of the shelter system, which was intimidating for many. So behind that number is a fundamental restructuring of the street outreach work. We have several of our partners here on both sides of the room, Ed Geffner, Tony Hannigan, Muzzy Rosenblatt, all who are partners in that work and have been a tremendous part of the reform. I made the mistake of starting to recognize people, because there's everybody in this room is part of this work. I don't know of anybody who isn't in some way helping. So you got to forgive me if I don't recognize you. I was like, Kathleen, you got me started. I shouldn't have done it. So on the homeless services side, what I would tremendous accomplishments on the single side, and on the street side, big challenges still to manage that issue on the family side. So HHC is the largest public hospital system in the country, and I really should know the answer of where it ranks just in terms of public and private total. It is enormous. It's close to a $7 billion budget, And I think the story of HHC is really remarkable for the leadership they've brought to have a safety net hospital that has not only as its, well, all right, we won't turn anyone away. That's not their attitude. Their mission is we will very affirmatively will open our doors widely to anyone who needs care, who can't otherwise get care, and we will make sure that they get the best quality care, the highest quality that we are capable of providing. And as a matter of fact, we want to make sure that we are pushing ourselves to be among the best provider. We're not going to be just a good safety net hospital system. We are going to be the best hospital system. One of the really groundbreaking things that HHC has done has been to post all of their data on all of the patient safety care indicators on a public website and to break it down by hospital campus. So there are 11 major hospital systems, has all of the data across the board so that they see how they stack up against themselves and they see how they stack up against state and federal standards. And every time, so you should go on. I don't know the exact website, but it's pretty easy stuff these days. You can figure out how to get there. And just take a look. And it is really remarkable how many times they meet and exceed state and federal standards. And where they don't, there is an action plan at the agency level in order to address that. One of the greatest signs of progress there is work that they've done in patient safety. So just preventable deaths and unnecessary hospital stays. They've had, now I don't really know what this stuff means, they've had a 65% reduction in the rate of central line bloodstream infections. This is a typical indicator of just poor care, where by going into the hospital you get sicker than you came and sometimes can die. And so their focus has been, what are those things where sort of the issues that come up routinely, and let's focus in on those patient safety issues. So central line bloodstream infections is one, a 65% reduction in the last 4 years, and a 90% reduction in the rate of ventilator-associated pneumonia. And these are really remarkable signs of progress in our hospital system that I think bring us to the point of really understanding HAC, not, as I said, not to be just a safety net hospital. Any of these things, as you can imagine, you could go on for the entire time, which I am at risk of doing. At HRA, this is our fundamental support system for people in need in the city. So our cash assistance, food stamps, and health insurance, Medicaid. Now the interesting thing, because in many ways, I think of DHS, it was a lead indicator for what we saw in the economy. The number of homeless families started ticking up before the recession really hit. It was actually, it was in January of that year. So that, are we 2 years into it or 3 years into it? But it was the number of homeless families started going up. It was now in retrospect we see it was starting to tell us a story about housing pressures and the economy before it really blew up in this country. The flip side of that is our cash caseload is like a lagging indicator. And so during these past 2 years, the cash caseload, the number of families receiving cash assistance, has actually continued to go down. Conversely, food stamps really has gone up. Medicaid really has gone up. Food stamps and Medicaid, in large part, that's been because of changes in the way that we make the systems respond more to client needs and time and place, and opening it up to ensure that people who are working but still income eligible could receive those benefit programs. And so part of that increase is based on that, but part of it is clearly also based on the needs that are driven by the economy. In the past 3 months, we've actually started to now see our cash assistance caseload go up. It's increased by about 3% over the last 3 months. So that's a sign, I think, of where we'll continue to see the cash caseload go probably for the next 18 months to 2 years. HRA has done just a remarkable job of helping people who are on cash assistance get placement into work. The number is just unbelievable in the last 8 years. 633,000 job placements for people who are on cash assistance, and that is an enormous number of people that are being helped to move back to employment. And this year's numbers have not dropped compared to prior years. So despite the recession that we've been going through, we have not seen a decline in our ability to place cash recipients into employment. It would be awful if I'm going to skip ACS. Maybe if somebody really wants to hear more about that, we can talk about it in questions. Because I'm thinking more, ACS, is obviously a perennial problem, whether you have a recession or not. And the work there their child safety work has been really remarkable. But what I want to do is maybe just talk a little bit more about some of the work that we've done on addressing poverty in the city and looking at innovative approaches to thinking about poverty. Because I think it's in part sets the stage for really what the challenges are in the budget scenario and the economy that we have ahead. So this is interesting. We have an official poverty rate in the country. It has lots of flaws, so we're experimenting with measuring the poverty rate in a different way. But with those flaws, let me just point out that the poverty rate in New York City has well, first of all, if you take the 8 largest cities in the country, our poverty rate is lower than most. I actually have this chart, the poverty rate, New York, the nation as a whole, it's around 13% in New York, which is around 18%, and then we stack up the 20 largest cities. And, it's kind of not, well, all right, we're willing to compete with 20 largest cities, despite the fact that there's like 2 or 3 of us like way up there, and then the rest are way down here. But among the 20, New York City is about halfway through. The top, Detroit, I always say, like when life is really tough, I always say, at least we're not Detroit. It's like 33% poverty in Detroit, which is just unbelievable. The poverty rate in New York City has been dropping for the past 2 years, and the child poverty rate has gone down by almost 2%. So one of the things to really reflect on in the difficulty of the situation is really, sometimes, we're focused on the problems that need to be fixed and how to make things better. I think it's just important to recognize that many of the things that we're doing are working, and our safety net is strong and is here to catch people when they need support, and that just in terms of poverty overall, but child poverty in particular, the poverty rate is going down. The way that the federal poverty rate is dated. It was developed in the late 1950s and made sense at the time. The cost of food times 3 was the way that the methodology was set up, and it accurately reflected need at that time. Spin forward, 20, 30 years later? 40, 50 years later. And it's extraordinarily outdated. Food is only 1/7 to 1/8 of what people spend. And so in terms of looking at how much do you need to get by, it doesn't count a lot of things that need to be counted. And it's also flawed on the income side. So all the money we spend on food stamps, on Section 8, those supports that go to poor households are not counted as income. So it's flawed on both sides. We've taken the National Academy of Sciences measure and applied that methodology to New York City. The poverty rate in New York City for the first year that we did it, which was 2006, rather than a poverty rate of about 18.5%, we have a poverty rate that's about 23.5%. So it's a full 5% more of our population in poverty than the national statistic would have you believe. And we're about to release an update of that, which will take that new measure, that more accurate measure, 2005 through 2008. And under that measure as well, the poverty rate does go down in this most recent year. So, I'm not at liberty. I'm handcuffed by my researchers in saying what the number is, but it's important to me to know where it stands and whether or not under that more accurate measure we actually see poverty going up. And so the starting point is that no, it in fact has gone down. So part of that I would like to think and believe is from some of the focus that we brought to the issue of poverty over the past 4 years. The mayor created a commission, and really asked the Commission to help look into some of the most challenging barriers that remain for people who are living in poverty in the city. The Center for Economic Opportunity put together that set of ideas, 40 initiatives, many of them now are 2 or 3 years underway, and we're starting to see some great results from that. So our conditional cash transfer program is built on a model from Mexico that has now spread to many essentially poor countries around the world, where you tie a set of activities that you know if there is a good performance on those set of household activities that relate to human capital development, that the chances of pulling a family out of poverty and breaking the cycle of poverty are improved. We took the model, we adjusted it for New York City, and have now 2 years of results. And I think the most promising pieces in that, very interesting, health, education, workforce development. The piece that is showing the biggest impacts is education for high school students. Now, all the smarties say, oh, we knew that. I will admit that I thought that the CCTs was going to have the biggest impact on the young kids, that even by high school, they're old, they're cynical, too many of life's challenges have already burnt them out, have already, I don't want to say ruined their chances, but compromised their chances. And so I thought we were going to see the biggest impacts for the younger kids. It turns out that it is the high school kids that are responding the strongest to this. So we've seen a 12% gain in just attendance. And we know attendance is so tied to graduation. And so just keeping the kids in the classroom is an important thing. More importantly, and this is the first time that a conditional cash transfer internationally has shown an impact on achievement, and so we've shown 9% gains in taking and passing the regents. And so that achievement outcome is also being hit. So that's a very sort of exciting set of initiatives that we're looking at. We've been talking to a number of other cities that are very interested in this, and maybe we'll start to see some new CCT models in other cities across the country. A little bit more testing and tweaking to learn really how this type of incentive can have the biggest bang for the buck. We invested $50 million in a child care tax credit. So that's gone out to about 50,000 households across the city to help low-income households cover that challenge of paying for child care. And we have a tremendous program. We just reported the results this week of our CUNY ASAP program. This is a focus on community college students who nationally only 20% of the students who enter community college will ever get a degree. They stopped tracking it after 7 years, but at 7-year point, only 20% of that entering class get a degree. So what that means is that people are burning up financial aid, spending hours, getting credits. I mean, how often have you looked at a resume and seen somebody say, well, I took 3 classes at CUNY? You don't put it on the resume unless you get the degree. It doesn't count. And so 80% of the resources being spent in community colleges is just going out the window. The focus of CUNY ASAP, the goal was let's graduate 50% in 3 years and 75% in 4 years. So we've just gotten our 2-year graduation rate, so it wasn't actually a milestone, but just to, we have a control and a test in comparison. Our test group that is in the program have 30% have gotten their 2-year degree, and the comparison group is at 11%. So 3 times the rate of graduation. And we believe we're going to more than exceed that 50% goal for our 3rd-year target. So that's really, those are just 3 of the initiatives that under all of our poverty, anti-poverty work that has been underway in the last term that really are showing very exciting, innovative results that I think can not only have a huge impact for those that are currently receiving them, but could have the potential of transforming a lot of the work that we do in social services broadly. The last thing I want to mention in this array, is the work in juvenile justice. And the Commissioner Hernandez is here. He's a commissioner. I have to recognize him. And David Burney, who's right behind him, sometimes builds buildings for us, so we'll recognize Commissioner Burney as well. But working across all of our agencies, and juvenile justice is hard because it's not, you don't control your own universe. If you want to do any kind of reform in juvenile justice, you need the family courts, you need the law department, who's the prosecutor in the cases. Of course, you need the Legal Aid Society, who represents the young people. And you need probation, who's involved. You need the Administration for Children's Services. You have so many organizations that are part of that assembly line that a kid goes through if they, in fact, come in contact with the criminal justice system. We have really worked hard over the past few years, and this is, maybe this is a little bit of the word about ACS. What I learned at ACS is that when a protective investigator went into a household and was checking whether or not there was a child safety issue, you often find them, and then the question is, what next? If the only thing you have is foster care, that child, and if that child's not safe at home, the child's going to go to foster care. The work is complex. It was many things, but I really think the linchpin in changing the trajectory of where our child welfare system was a big investment in community-based prevention. And so in 1996, when I went to the Administration for Children's Services, we had 40,000 kids in foster care, and we had less than 10,000 kids in preventive services. Now, spin forward, 2009, we just went under 16,000 kids in foster care for the first time. And we have almost, is it like 35? There's experts in the room, I don't know, about 35,000 kids in preventive services. What we just did is we gave that protective investigator and we gave the family court judge an option that if the child's not safe at home, there are options that can help the child stay safe through prevention. And so investing in prevention. That lesson, I think, really just got transported right over to juvenile justice. The young people that are being arrested, if there aren't community-based alternatives that will allow a prosecutor and a judge to feel that not only the child is safe, but more importantly in a criminal justice setting, that the public is safe, that they are going to keep that kid in detention. And when the kid moves on, and if the kid is sentenced, if there aren't alternatives to incarceration, the child's going to stay in prison. And so we've done a ton of system reform, but a big part of solving the challenge was making those investments in community-based alternatives. And what we also know with the young people in the juvenile justice setting is that the target of our services is the parents as much as the young people. That the struggle for sometimes when a young person is becoming more difficult to manage at home, it's that a parent can become incredibly stressed by that. And so if our interventions can focus not only on the young person's challenges, but on the parents' challenges as well, and bring a support to both, that you can have a successful community-based alternative. So this is really remarkable. In the 4 years that we've been doing this, we have had a 57% reduction in the placement of kids into detention facilities. And so all of the work along the way, okay, now I have to edit. This is if you want to invite me back for, if I'm a recidivist too. This is worth, a whole discussion. But the fact that, from arrest through arraignment, through sentencing and detention, that we've been able to reduce by 57% the kids who are doing time is a huge game changer for their lives, because we know if they wind up in juvenile detention after they're serving a sentence, for boys, 85% will find themselves rearrested within 3 years, and for girls, 50%. It is a life-defining event. So breaking that possibility at any point along the way can be truly transformative for these young people. The good news is that all of these interventions also show not only are we not placing them, but they are also having less likelihood of being rearrested in the period after they are engaged in their program. Okay, I have to stop talking about the past. I only have 5 minutes left to talk about the future. What time should I stop talking? 5 minutes, okay. That's good, because then I can't give up too much that I shouldn't be telling you about. So there's three things. What are the important issues? What are the important processes? And what are and technology? That's an important process too, but it's a facilitator. So it's going to be really, really difficult ahead. Our agencies now are preparing budget cuts of 4 and 8%. It doesn't add to 12, despite some tabloid math. It's 4% for this year, annualizes to 8% next year. The strategy that I have asked my agencies to take is to avoid across-the-board cutting. What we know is that it's the easy, cheap way to get a peg done. You piss off everybody a little bit, you spread it around, and nobody gets so angry that they really scream out loud. I think that's debilitating to our ability to meet need. And I prefer instead looking at the range of services that we provide and stacking them up and trying to make some decisions about which of the ones that are truly needy, that are the highest performing, and that are helping the most, and isolating out and considering elimination of those that are not performing. It's a really difficult political strategy to take because an elimination of a program is always going to get more folks on the steps of City Hall protesting than just across-the-board cuts. But I think if we continue to do across-the-board cuts, our organizations are not going to be able to sustain the support that they have to give to the people in need in the city. So that's going to be a huge challenge for us. So on that point of in the social services, 85 to 90% of our work is done by nonprofit organizations. Louisa Chafee is here with us this morning. She works with me at City Hall and has been focused in the past couple of years on thinking about this issue of how are we going to help our nonprofits be strong through the recession. We have what I think is actually a number of really exciting initiatives. So one thing, sometimes budget cuts are never good. You don't want to wish for a budget cut. But sometimes they actually provoke action that you should have taken a while ago and didn't take. So for instance, because of the challenges in our nonprofit community, we've brought a lot of people around the table. We're working together in excess of meetings, but they're getting somewhere. And so the nonprofit community, can you imagine if you took all the nonprofits in the city? There's something like 2,000 to 3,000 nonprofits who contract with the city, and their purchasing power is in the billions. But right now, everybody does all their own stuff. They buy their own desks, they buy their own chairs, they buy their own food, they buy their own office supplies. We're at the point, is the RFP released? Yeah, so we actually, not us, but in a collaboration of nonprofits through the United Way, have released an RFP for group purchasing to throw all that purchasing power into one tool. And now I don't know that it'll be one provider. It might most likely will wind up being a couple providers. But the efficiencies that are going to come out of that and the savings, and so we get the same stuff, maybe we get better stuff. Each of the nonprofit organizations will be able to have the work done for them in great part at lower cost, and we drive those savings back into the agencies. Those savings in part can help us to meet some of these budget challenges, but can also help the agencies to keep their staff well paid and motivated and strong to meet the needs that we have. So that group purchasing RFP, and of course our partner in crime, Marla Simpson, who's been brilliant in helping all of this procurement stuff, is going to make a big difference. That's an example. Like, why didn't you do that 20 years ago? Why did it take? But it took this moment, and it got us there. We have a number of great collaborations going on, private partners that have come to the table to assist. We have what we call our Greater New York collaboration, private sector partners pairing with nonprofit leaders to help them think through strategic planning for their nonprofit during this time. We've increased our returnable grant fund. Unfortunately, it's a good thing when we invest $20 million to help nonprofits bridge the gap when cash flow is not smooth at their agencies. So we're doing a lot of work and thinking around strengthening nonprofits. You know, and before I'm gonna go a little bit more, Ross. Forgive me, because I'm going to tell you about technology and procurement, and then some important issues. So in technology, we have this really great initiative called HHS Connect. Again, it's a story. So, you know, all of my agencies, everybody has their own technology system. I was the Commissioner of Homeless Services. I think I had 6 or 8 or 10 big standalone systems in my own agency that didn't talk to each other. Of course, I didn't talk to any other agency. We're about to launch what we call the worker portal of HHS Connect. What HHS Connect does is it takes all those standalone systems and it federates them. All right, I don't know anything about technology. All I know is that it's built a link so that you can translate. It's a language translation between each of those independent agencies into the center that then translates back out. And so starting in January, if you are a child welfare worker and you get a new case on your caseload, you'll be able to type that child or mother name in, and you will be given information about every household member and every service contact they have with the city that you have the legal right to see. So we have the system of, it took us quite a while to build it, because you can imagine both the technology of making that happen was the first barrier, but just understanding the confidentiality and protecting the rights of the clients so that there isn't any information beyond which the individual worker is privileged to see. But the very fascinating thing on this, there was hundreds, I think it was like, it could have even exceeded 1,000 decision rules of confidentiality. And when you went through them, the conversation always was, you can't do that because you don't have a privilege to see the information. When you actually logged it all, the majority of things were in fact permissive. So if you have an interest in the case, you can see it, or mandatory. You have an obligation to share that information. And so what we did, we haven't tackled the really tough confidentiality issues. We said, let's leave them behind, because they're getting in the way of allowing us to share where we're allowed or required to share. So let's just build it on that. So now in January, this is really going to be transformational, because any time in the past you wanted to do a cross-agency collaboration, you couldn't, because a worker couldn't even know if somebody else was active in that household with a different agency and a different service. And so this is going to be the first time that individual workers will be able to log on when they get that case and see, you know, is there a probationer in the home? Is that mom receiving services from any other agency? And it creates the ability to start to make those case contacts and to talk to the team of people that are working in the household. And so for me, this tool we've spent 4 years building it, and starting in January, it's the point where we can now think about business practice and casework practice and start to do all that work we've dreamed of in serving families in more holistic ways. The other, like I'm a government geek, right? I actually get excited about this stuff, and something that I am looking forward to tremendously is procurement reform. Woohoo! Right? Are you excited? Right? This is why you got up early this morning. Can talk about procurement reform. So here's the idea. So all those thousands of agencies, of course, here now ACS. I remember my days at ACS. I had one One nonprofit might have 5 different contracts with that agency. Maybe there's a child care center. Maybe there's a community-based prevention program. Maybe there's a foster care program. Maybe there's a residential foster care program. So you have all of these programs, but every program have a different RFP, a different contract, and so, you know, you give your stack of papers like this, and then just multiply that by agency. What we've been working on and will be starting to put out in the next few months is a change in the way that we do our work with our nonprofits, to move to a concept of one contract. If you were a nonprofit working with the city, you will need only one contract. All the nuts and bolts of everything you need to do, background and employment and fingerprinting and this report and that report and charitable report and state report, everything will be done once and will be on record, and you just keep it live. It's sort of open. It's like there's no respond by a certain date. It's a constantly open list to sort of verify your status as a provider with the city. You get all that contract stuff in place, and then when agencies want to purchase services, they only focus on the conversation related to the nature of the service. And then when you are selected as a provider, you tap into the authority, the legal authority of that underlying contract. This is making a lot of lawyers in the room nervous. And we've been working, we haven't quite crossed the T's and dotted the I's, but I think what this is going to do is really, really fundamentally transform the way that nonprofits experience their relationship with the city in that procurement process. I know you're really excited about that. Okay. None of that is about, you know, what are the issues that we need to work on. And I'm just going to say some of the issues that we think really need focus, and I'm not going to talk about them at length. You may find that hard to believe, but I'm going to do my best. Young children, 0 to 5. We have a huge transformation that has happened on the public education system, and I think what we need to focus on is bringing more kids to school ready to learn. It is lots of good stuff has been done, but not enough. So I think that's really got to be a focus in the next 4 years. Across systems, let's go back to the ACS juvenile justice conversation. Essentially what we have is a lot of systems that use too much institutional care as the intervention. That goes to our aging population. That goes to the mental health population. We need to look at more community. We need to look at a culture of community-based support for people to deinstitutionalize across spectrums. Obesity, I said it earlier, but I'll say it again. We've not even made we've slowed the increase, but we are still getting fatter as a city, as a country. We have got to do a lot more on obesity and nutrition, and young men of color. The unemployment rates that came out yesterday, I think, were 10.3 in the city. Am I getting that right? It's under 11, but it's if you're a young black man, you're double that. It's just and so we need to do a lot more focused on all of the challenges of young men of color. And I think we continue to push on our public health agenda. There is, for every threshold we cross, it just opens another door of more improvement and things that we can and should be doing. And I think that will factor in largely in the next 4 years. So that's my highlights of those. And if you want to talk about any of them, I'm glad to. Ross?
A terrific rundown. We have open mics here. There are microphones here. If you would go there, and we'll take questions. We have about 15 minutes, and we'd like you to go to the microphone and ask questions. Somebody should stand up. While they're, let me make a couple of announcements myself. First, these breakfasts are broadcast on our website, and they're broadcast live, and then we library them so that you can go back and see all of our speakers over time, including Linda Gibbs in 2007, and compare what she said today to what she said then. I'm sure they're consistent. Secondly, this is even more important. The black pitchers on your table are coffee. So some of you may not have known that, and you can get coffee there. And last, all of these breakfasts now will be invitations by email. So if you didn't get an invitation and would like to be sure you get invitations in the future, please give us a card and we'll make sure you're on our list. So now microphones are open for questions.
Hi, Linda.
Hey.
I'm Alan Kleinman with the New York City Law Department. So one thing you didn't talk about is sort of the intersection between poverty and undocumented people in the city. And for HHC and for other agencies, that's a huge issue. And to some extent now, there is some matching federal and state funds that go to undocumented. And then what you have in the national debate on health care is a virulent anti-immigrant move, which would affect funding sources for undocumented in New York receiving various services.
Mm-hmm. Yep.
And I'm wondering what the administration's
Yeah.
political response would be to sort of the national climate in this area.
Right. Well, I think you know how strong an advocate the mayor has been for protecting individuals who are undocumented and calling for national health care, or excuse me, national reform on immigration. In the health care arena in particular, the HHC, as our safety net hospital, will not turn anyone away, regardless of documentation status. And things like, when you are thinking about the H1N1, we know that we need to send out very strong, clear messages to individuals that you can come in and receive this, that you won't, that it's free, that you're eligible, and that is really the message over and over again with our public hospital system as well. The big issue for us in healthcare reform has been, there's two issues. One is that it would be nice to see some reversal of some of the ineligibility standards that were created in Medicaid a few years back, where it requires that you're legally in the country for 5 years before you can become eligible. So first, if you're here and you're legal, you're a new immigrant and you're legal, why should you be denied coverage for 5 years? Secondly, for those who are here illegally and we know they're here and their kids are getting taught in our schools and they're working in our streets, and maybe somebody wants to say you should just have them all leave. The reality is that they're here and we want them to be healthy, and we want them to be healthy for themselves, and we certainly don't want them to become a health risk for others. Our HHC depends greatly on what is called disproportionate share payments. By the way, I didn't mention HHC's $1 billion budget gap for next year. I mean, we have a huge budget problem at HHC that healthcare reform could make worse. The reason healthcare reform you would think it would be better, right? We're going to cover more uninsured people, so this should be better. New York City actually covers already in excess of what the healthcare reform expansion will cover in the rest of the nation. So we're in New York State and New York City as a result. So we're not going to pick up that many uninsured people in healthcare reform. But one of the ways that they're proposing to fund healthcare reform is to take some of those disproportionate share dollars and move them over to the cost of things like the subsidies and the benefit packages. So we've been fighting really hard with Senators Schumer and Gillibrand to fight for that disproportionate share dollars, to make sure that the safety net hospitals are financially looked after as we take care of ensuring more people in the country.
Good morning, Deputy Mayor Gibbs.
Good morning.
Thank you very much for speaking before us here today. My name is Deanna McKay. I'm here representing America Works. We are an HRA back-to-work vendor. We're the #1 rated job placement vendor in New York City. We recently started programming to provide services to veterans throughout the city. And we just this Wednesday testified before the City Council on veterans' needs, as well as the United States Senate.
Yep.
I wanted to know, what are your thoughts on the needs for veterans today and for the future?
So America Works has done a great job with HRA. A great number of those 633,000 job placements was from that partnership. And actually, under the stimulus initiative, there's a lot of money for job training and employment, and America Works is fitting into some of those initiatives as well. The issue of veterans is, it's quite the tragedy. Tony and Ed and Muzzy know this well. I don't know if I'm missing anyone. particularly when you look at the street population, there are more likely to be people that have served in the armed forces. And the nature of the structure of veteran services has been that the federal government actually offers a lot of support services, but doesn't have the residential component. And the city, of course, has a shelter system that many of our vets, there's many vets in shelter as well, but a disproportionate number of vets on the street. What we did at the Department of Homeless Services that is really the kind of, it is brilliant, because sometimes it's easy to have a good idea. It's brilliant to figure out how to make it work. Bringing together all of the housing supports that the city could offer through, not through shelter, but through subsidized housing, and pairing that with all of the resources the federal government has in terms of the service supports to create a package of stuff that actually can solve problems for vets has allowed us to virtually eliminate homeless veterans in our shelter system, because they are now all in these sort of more comprehensive veteran supported programs. I think the real challenge for us is now the new young vets. We have seen that. We certainly have seen already some vets from the Iraqi war and the Afghanistan war and in our shelters, and it's just really heartbreaking. They're often families, young women with children. And so making sure that we have supports and services that, in fact, respond. One of the very strong things I've done with HRA and DHS working together is bringing the work focus of HRA and the shelter focus of DHS together and pooling those resources in a way that actually help people not just overcome homelessness, but also overcome their economic need by getting them into an employment trajectory. We're having really great success with that piece. Thank you.
Let me ask a question. One of the areas that you listed as still having difficulty is homeless families. And I wonder if you speak more about that and your analysis of what's going on and perhaps what new initiatives you might be doing.
It's so what do we have now? I think it's close to 10,000, maybe even over 10,000 families living in shelter. A typical family will have 2 children. It's parent and 2 children, so it's, maybe 29,000, 30,000 family members living in shelter, and that's just a huge increase. It was actually so. Here's what I did. I said, all we do for families in the city is give them shelter. We need to go upstream, and we need to prevent homelessness. And so we built a community-based prevention program, home-based throughout the city, contracting with providers in all of our communities. And one after the other, great. It works. It's not as expensive as shelter. We're helping people intervene earlier. We're really helping. This is a model that is fabulous. And so, let's pop the champagne bottles. This is great. We're solving homelessness. But in the meanwhile, on the other side, the number of people coming into shelter is still huge. And so it's a quandary. I have to say, I think this is one of the toughest social service problems in terms of thinking through problems that we have. So providing community-based prevention helps a lot of people, but it doesn't reduce shelter homelessness. The number of people coming into shelter it's maybe a little bit off of what it otherwise would have been, but the number of people coming into shelter is still huge. I believe that just when you look at it within the context of homeless services, that we do need to have more accountability in the shelters. There are too many individuals who come into shelter and do not do what is necessary in order to overcome their own homelessness. And we have not done an adequate job in managing that public resource effectively. And so we have good, humane shelter, but we don't have accountable shelter in that sense of individuals receiving shelter, doing their part of the job. I think fundamentally, we're a crowded city. right? If you want to really talk, so it's, you can talk about managing the shelter system, but the real, I don't know in any society that you will ever completely overcome homelessness. I have colleagues working in other parts of the country where they have housing vacancy rates in 10 to 20%, and they still have homelessness. So part of it is people that are just struggling and they stumble and they mess up, and so there's always going to be that kind of marginal homelessness. But we have more than marginal homelessness here. And I think that really does get back to the fundamental questions about housing in the city, the adequacy of the number of units, and the affordability of units, and the availability of rental assistance to help people who don't have adequate incomes. This has traditionally been a federal role. Anyone who has any experience right now with the Section 8 program knows that the federal government has not been kind. We're hoping that that story might change in the future, but it has, the Section 8 and the housing authorities across the country have literally been starved. And what they are forced to do is manage the same amount of resources with less and less and less. And I think we have to have big solutions to affordability. And separately, we live a little bit in sort of a the fact. I mean, the HPD publishes the housing and vacancy report every 2 or 3 years, and we publish, here's the number of doubled up and overcrowded housing. It's not as if this is a secret. Everybody knows that there are way too many people living doubled up in the city. And part of the challenge is, how do you create physical infrastructure, and what are your standards and expectations so that you can try to use the housing resources that we have efficiently and effectively so that people can have decent, safe places to live, and you can meet the need. I mean, the great story of New York is, of course, the waves of immigrants that come through. It is still true, and it will hopefully continue to be true, but that means that many people come without much resources, and they move in with their social network that is here, and we know that is, we hope, I believe, we hope that will always continue to exist, because that just feeds the blood through our system. I think that we probably are overdue in looking at some of these questions about what our expectations are around the housing standards that exist, and whether what's on the book matches what the reality could be. And I know we're running over. Do you want to take one more?
I'm sorry, I can't. We always end at 9:30, and we're going to have to end right now. I want to thank the audience, and also thank Linda Gibbs for coming. It's always nice to celebrate successes, and I'm glad that you brought so many successes to us, but you also leavened it with the issues that remain, and that is also sobering and useful. So thank you for a wonderful and interesting breakfast. As we always like to do, we like to give to our speakers a product of the research of this law school, and I'd like to give Linda a copy of a book from my colleague David Schoenbrod, Saving Our Environment from Washington. It discusses how to get out from under Washington. So I think it might be appropriate. Thank you all for coming. See you in February. Thank you. You'll like this. It's very interesting. What a portfolio.